I have the three founders of Genetesis here in front of me. It is lovely to be with you all today. Thank you for being here.
Thanks for having
Great
us.
to be with you.
Thank you.
So I want to start by hearing from you about your founding story. How did your company come to be?
We were founded in 2013, actually. So Piyush graduated a year early from high school, and he went to India for the summer and told us about how he was scribbling in his notebook all summer with an idea that he's been kind of playing with for a while now. But he came back from India. We had a barbecue to send him off to the Ohio State University for his freshman year over there studying biomedical sciences, and he pitched us all of our friends at that barbecue. And Vineet and I somehow decided to take a jump off that cliff and wanted to pursue the idea with him.
I always say that was the best pitch I've ever given. I got these guys to
Can I hear it?
tag along. I don't even remember what the pitch was like. It must have been good enough to convince these two, but it was something along the lines, because the idea was, I'd been working in the lab and I was really excited about this idea that in the lab we were measuring electric currents at an individual cell level. Isolate cells from an animal, for example, and be able to measure the electrical properties of that cell. And I had always wondered how that was being done clinically. And it couldn't be further from how we, as a standard of care in medicine, actually do the same procedure clinically. We're relying on much more outdated technologies, things like the EKG, stress testing, putting patients on treadmills, injecting them with radioisotopes.
Right.
So it was very disconnected. And we didn't really have much of an idea of how we were going to solve the problem. We just knew that it was something worth solving, and it was a big, difficult problem. And I think that's all I needed to convince them.
And how did you three meet?
Childhood friends, honestly. So we've known each other since middle school, basically, all of us. And so we spent pretty much all of high school together. Yeah. We're involved in a lot of same extracurriculars and social activities and that kind of a thing, and had a pretty tight friend group as a result of that. And so, to Piyush's point, when this barbecue happened and he pitched us, we were the only ones brave, or maybe foolish at the time, who knows, but crazy enough to go ahead and go along with it. Yeah, exactly. Go along with it and say, you know, we're going to try this out, and we're going to see if this actually grows legs and where we can take it from here.
Was there something specific that Piyush said then that convinced both of you that, you know, this might work?
There was really a big hype train around like Silicon Valley around that time.
Yeah.
I think the social network had come around that time, and we were really excited to just start a company and test out a new idea and try to help people in the process. So I think there was a little bit of influence from there, but I think what really drew us to the idea just in general is like it came from like a noble mission. It was a really personal story that kind of like, I think, you know, motivated us to, you know, try to help solve this problem, or at least, you know, kind of crystallize what we're exactly trying to solve.
I think beyond that too, a lot of us have reasonably technical backgrounds, right?
Yeah.
So it's like we had a decent idea, and I think in some ways a good thing. It was a naive approach to say, well, why wouldn't that work? Kind of a mentality. And I think that really propelled, at least I'll speak for myself, but hopefully Manny and Piyush too, to think, well, it's worth exploring and figuring it out, because no one ever knows if it's ever been thought about this way before. But if you can think about how to bring these cellular level insights at the larger scale of the body, there are basic science principles that say this should be possible to do. Yeah. So what's standing in our way? And so that was really, I think, the impetus to say, more so than just, we'd love to start a company together, but it's also that context of, we believe there's some technical feasibility here and possibility to make this into something real that can affect lives.
In the most basic of terms, because I am neither a scientist nor someone who is in the medical profession, explain to me exactly what you are building and how it helps people.
Yeah. So maybe preface behind that too. I think today there's a big over-reliance in the medical field and the community on over-testing and using surrogates of measurement to detect whether or not a patient has a specific type of a condition. And oftentimes you're missing the real heart of the issue in terms of what's actually going on physiologically in the body. So how are the organs actually functioning and contributing to whether or not the patient actually has the disorder? So as a result, you can get all kinds of false positives, false negative tests, because the tests they oftentimes use in clinical practice today aren't truly analyzing the condition that they're interested in. And so that was really, I think, the impetus to go ahead and say, okay, what can we do to better look at specifically the heart's electrical activity that causes it to beat day in and day out? And are there more nuanced and more insightful ways we can actually look at that information in the heart? And so that was really what pushed us to look at this technology called magnetocardiography, which was looked at in the 70s and 80s and 90s, but kind of abandoned for a bunch of different reasons, but some of them related to cost, accessibility, and that kind of a thing, and say, what can we do to actually make this technology more accessible? And that technology itself, the way it functions basically is looking at the natural magnetic emissions of the heart. So the heart naturally has electrical activity that causes it to basically pump blood throughout your body, and changes in that electrical behavior ultimately lead to a lot of different types of disorders, or they can be the symptoms of different types of disorders as well. So we're able to use magnetic field analysis, basically. So we're able to measure the magnetic fields that are naturally emitted by the body as a way to see those types of disorders and see whether or not that electrical activity is performing normally or not.
Now I want to pivot a little bit and talk about Ohio. I know all three of you have deep connections to the state, and we're here in the iconic Southern Theater in Columbus, Ohio. Why did you choose to set up your business here?
That's a great question. So we grew up in Ohio. Big reason to set up shop here is that we knew the community knew us. And very early on when we were kind of thinking about, do we take this med tech company to Boston, to San Francisco, where you would typically think you would build a med tech company. The city of Mason put the pause button on and said, well, why don't you just build it here? And what if we helped you recruit the right staff? What if we helped you build out the facilities that you need? And it became silly to not treat them as the top choice at that point. So,
and there's another level of that too, which is even in our very, very early days when, we were all in our first years of college basically at various universities in Ohio, where Cincy Tech ended up being a very, very strong partner as well in the community. So they're a local venture group in the Cincinnati area, but they were able to give us, I think, a lot of important advice and help us through the entrepreneurial journey early on. And in a sense, too, that helped us also acquire early funding through them. I think as a result of that, too, that early advice and mentorship, I think, also went a long way in us deciding that this is actually a place we can call home.
So you guys are clearly a product of the school system of the state. How did you get the medical expertise, the scientific expertise you needed to build this company?
Yeah, we all have a little bit of a difference in background. So Push's background, as he was kind of alluding to, he gained through experience and a lot of self-learning and through his mentors at Ohio State. Vanita and I's background's a little bit different. My background's in computer science. Mason had a really strong computer science, computer programming program there. So I learned, starting at the age of 14, how to develop software, and kind of leading that into Ohio State. It just kind of helped hone skills a little bit, and then ended up applying them to a real problem that hopefully can help people in the future.
After high school, I went to school at Case Western Reserve University up in Cleveland. I studied electrical and biomedical engineering while I was there, and so beyond just the public school system here, even I think a lot of the universities here have set us up for success there and taught us a lot of really, really important skills that I would say pretty much every day we bring to work.
How did you take it from that idea to finally getting some capital, and what was it like for you?
This is a fun story. We reached out to Mark Cuban on a cold email.
Wow.
And
Bold.
at the time, it was crazy. What do we have to lose? We're a couple of high schoolers, college kids at that time. We've got an idea, we want to run with it, what do you think?
Not?
And actually initially Mark responded, and quickly at that, with kind of this seems really interesting. I'm from a health perspective very excited about what you're trying to do, but prove to me that it's got legs. Prove to me that, so that's kind of in my mind the type of role that early mentors like Mark, like Cincy Tech played in our careers and the development of this organization, which is just to say, just prove it.
Yeah.
Just do the bare minimum from what you have to prove that this thing works, that it could work. And so I think that was motivation enough for us to try things, and we found ways to demonstrate proof of concept with our technology at fairly low cost. But Mark Cuban then ended up leading our seed round with Cincy Tech in 2016. So we ended up raising about $1.5 million. And since that point in time, we've raised about $42 million through seed to Series C. And progressively, each round has come with its own fair set of challenges. A lot of Ohio support, for sure, but we've been able to recruit capital from the coasts, from venture funds, family offices from really around the country. And I think that's a testament to Ohio and the fact that you can build something great here and do it cost effectively and do it in a way that attracts some of the best venture funders. In 2016, right before we had gotten Mark to lead the seed round with Cincy Tech, we had developed a software prototype of our technology. Again, we're analyzing the magnetic fields that are being generated by the heart. So it turns out that people had built these systems. They looked like large lunar modules back in the day, but they existed. Right. So we asked ourselves the question, who had those systems, and can we test the software prototype on some old version of the system and demonstrate that we can at least analyze this data better and maybe make our own hardware later. And of course, that's what ended up happening. But we ended up partnering with the Mayo Clinic on a small pilot study back in 2015, 2016, to demonstrate that we were able to put together at least a core element of this technology, which was the software and the analytics engine to analyze the magnetic field data of the heart.
What do you think has been the biggest challenge that each of you has faced in making this company a reality so far?
I feel like, for me at least, a lot of this has been about having this mindset of this actually is a marathon, not a sprint, especially in the medical device world, right? Because a lot of the validation is very, very important to prove that you have safety and efficacy, because it's ultimately going to be used on real patients and affect real lives. Right. Involves a lot of patience that you need to be able to have in terms of working through, in some ways, the processes of the approvals process and the validation process and everything like that, and being very, very conscious of what that means from a technology development perspective, a team growth perspective as well. And so I think the challenge, I suppose, really is that level of learning how to, I think, have grit and tenacity throughout the whole thing, because there's going to be a lot of those setbacks that you're going to face as naturally as part of the process.
For me, the biggest lesson has been exercising humility and realizing that because it takes as long as it does, and you have to approach, I had to approach this with a lot of, I really don't know what I don't know about this industry. Yeah. And so it's important to hire the right people, engage the right advisors, and let them guide. Because it's very easy to want to take shortcuts. And we've learned the hard way, it never works to take shortcuts. And it shouldn't, because ultimately it's patients on the other side of this, and we want to do what's right by patients who are supposed to benefit from this technology. So everywhere from engineering to financial planning to how we engage with the FDA to doing clinical trials, it's find the right people to help advise and guide you on the domain-specific thing, and just exercise the humility of we don't know what we don't know.
And it's actually an important point too, because there's so much also in the other areas where you cannot just rely on an expert, where nobody really knows how to do this thing if it's so new, right? And so that's another challenge of having to approach everything with some kind of a balance of intentional naivety, as well as trying to make sure you have the right support behind you to do things the right way.
Definitely. Where do you see your company in 5 years or 10 years?
Hopefully in commercial stage, and patients really getting the benefits of our technology in their daily lives. So hopefully if we can even affect like a single patient's life positively, I think that's kind of the end goal that we want to achieve. And
for you two, what do you want your legacy to be?
I mean, I think it would be incredibly exciting, and I would be very proud if we as a group were able to bring something this new to market and have this become standard of care, right? Something that's a brand new type of imaging modality that can really, really impact patients' lives, improve the patient journey throughout the process. And so, I want this company to become something where it's not just a single application like we have to focus on from the early days with the FDA, but eventually something that's going to be more multimodal and focused on looking at these signals and disease states that before were really not even touched or looked at before, right? If this is a technology that eventually, I believe personally, could help uncover new types of diseases and disorders, help guide new types of therapies and treatments, that's something that, at least personally, I would love the legacy of the company to be.
Yeah, I think for me personally, the legacy is very tactical. A lot of the technologies that exist in our standard of care today, they're listed explicitly in our guidelines. The cardiologists in the US refer to the American College of Cardiology chest pain guidelines, for example. Our technology has a place in those guidelines. And to be in those guidelines and to show the world that the standard of care has fundamentally shifted, and there's this brand new technology that deserves to be at the forefront of those guidelines, I think that's, for me, proof that we did what we set out to do. And from there, whether we're the right team to take it to the next level, or it involves a new team or augmenting, whatever it may be, we'll know that we're on the journey to truly saving lives, improving quality outcomes for patients across the globe.
Fantastic mission. Well, thank you three so much. I've learned so much, so I really appreciate you being here today.
Thank you.
Thank
for
you so
having us.
much.
Thank you.